Hi everyone, I'm Pieta Valentine. I've written 2 books, The Resident's Voice from a Dementia Unit and The Resident's Rise from a Dementia Unit. Today's session is on the doctor's meeting, and I'll just update you on the previous video I've just done on preparing for the meeting for those of you that are viewing this video for the first time. So the patient central to this is the mother, who is 85 years old. She's just been admitted to the unit. This is her first doctor's meeting at the unit. She has Alzheimer's dementia and she's got a frozen shoulder. Other than that, she's fit and healthy, and she hasn't got any other diagnosis to speak of. So the doctor's there, the nurse is there, the clinical manager, and the son, the stockbroker, and his sister. So the day's arrived. You've upskilled mum, the stockbroker's son being the protagonist. He's upskilled mum on the meeting that's coming up and a little bit about it so that she's, settled with it. Okay, so 9 o'clock Monday morning, you're at the meeting, and you're a pretty confident guy, so you start up with it. You've decided it's best to sort of go forth with all your questions because there's quite a few. So you've read up all the notes, you've read up on the medication, you're a bit concerned about one of the aspects of medication, so you bring this up first and you say to the doctor, I've read up the clinical notes and thank you for that, supplying me with those, and your sister, power of attorney, giving, she's actually a generous sister, and she lets the rest of the family know what's going on with all the notes and gave you permission to have a set of the notes, so that makes it easy. Anyway, you've read up the notes and you're noticing that one of the medications, haloperidol, that she's on, you've just read a little bit about it, and you notice that it can give a bit of tremor and Parkinson's type symptoms with what we call a festinating gait or a shuffling gait. And you have noticed that mum is on that medication, and that her gait, which has usually been, her strides have usually been strong and stable, and she's been a confident walker all her life and never had any troubles with balance. And you're noticing lately that her balance is just a bit off and her strides are shorter, and she loses balance sometimes. She's got like a stuttering gait, and you discuss that with him, the doctor, and you're saying, look, I just am wondering whether the medication might have something to do with it. The doctor, he's a, liberal, broad-minded man, and about a similar age to the son. And they actually have a common interest in cattle, the son being a stockbroker, and the doctor's got a farm where some of his livestock are cattle, so of course they've got a little bit of a common interest now, which always helps. So they just discuss that a little bit. Then they get back to the haloperidol, and the doctor says, yeah, well actually it is a side effect, that's right. We just put your mother on that to settle her a bit because she was anxious, but if she's getting those symptoms that you've mentioned, maybe we can just lower that a bit, or just look at adjusting it, or bringing in another medication. And the son is very grateful for that. Yes, that would be great actually if we can adjust that, because really the main thing for her is her walking and her independence. She's always been strong, independent, athletic, and if her walking goes, she'll have no quality of life. So the less medication the better, frankly. She's never been on medication before, and we as a family will try to work with her stress as best as we can. Maybe I can take her out to the farm, for a night. A weekend away might do her good, and we can sort out with the grandkids to come in and take her out for a walk outside so she can get the fresh air and sunshine. And we feel as a family that will reduce her anxiety enough. I'm sure we can reduce her. Isn't it, Mum? How do you feel about this? Ask your mum. Well, yes, I would like to go out to the farm for a day. I just need to have a break, and I like walking, and if I can go out every day, that would be good. So yes, well, Mum, we'll organise a plan for that. We'll get a bit of a roster going and put it up on your whiteboard in your room, big and clear, so you can see who's coming in and on what day, so that you can have a walk every day. And that way all that anxiety and angst will disappear as you get all those, endorphins and good feelings from your exercise, which you've always, yes, I think that will help a lot, dear. So just this sort of banter goes on in a well-informed group. So anyway, the time's ticking, both for me and the doctor's meeting, because at a doctor's meeting, typically 10 minutes, you've got not a long time, similar to these videos actually. Okay, so the next thing is the frozen shoulder. Mum can only lift her arm about 20-30 degrees, really painful. And you say to him, look, I've worked with cattle, I've given them steroid injections for their arthritic shoulders and it works a treat. So how about, this for Mum? And the doctor, seeing that you're well informed, no trouble actually. It's a bit difficult, I have to say. Giving steroid injections in the exact spot is not actually that easy, but he could say that, oh look, I've got a colleague at the clinic, he does steroid injections in shoulders a lot. He's got all the equipment, the MRI and the scans and stuff, so that he can make sure that the injection is on the exact spot. So I suggest that you bring her in to see him. It's better if he gives the cortisone injection because it will be the perfect location and, generally it works really well. So you're grateful for that. Well, that'll be great. That's all set up. And that's it. The meeting's over. You've got your mother on less haloperidol. You've got the walking program sorted. You've got the cortisone injection coming up for the shoulder. Her anxiety will settle because of less pain in the shoulder and movement. Once the cortisone injection starts working on that, she's getting a walking program going on outside, so she won't need the haloperidol anyway, or just a low dose, so that chances are it won't give those Parkinson's type side effects so easily. There you have it. It's, it's all done and dusted. So that's a good example of a well-informed doctor's meeting where, one of either the power of attorney or the sibling is well informed. They ask clear questions, they get good answers, and they get a result. So it's so important to go in informed. Otherwise, if you don't know what's going on, the doctor may well say, oh, well, your mother's unsettled. I think, it's a good idea to up the medication a bit so that she can settle down. And if you're not aware of the side effects, and that with haloperidol, for example, that medication gives Parkinson's type effects, and festinating gait on the walker, little balance. It's the quality of life. And then often the person can't even walk effectively after that. They're on a walker. It's terrifying actually when your balance goes. So if you can save anyone from that, and many people think that with Parkinson's, with dementia, you get Parkinson's anyway. It's a part of it. And maybe, yes, people do get Parkinson's, but it's the medication often that can play a big part in this. And so at least if you're informed, you can, take that effect out of it, that risk factor out of it. So that's the session for today. For those of you out there that are preparing for doctors' meetings, good luck with all your study. If you have a friend who's a nurse or a carer at a dementia facility, they will certainly be upskilled with all these things. Talk it through with them before the doctor's meeting so that you're well versed when you go in. You can be confident with what you have to say. And generally, most of us have a nurse or a carer or a friend or someone we can call on that's worked in the medical industry who can help you go through, all the diagnoses and definitions and the dialogue of what you would like to say at the meeting. You're not used to dealing with medical banter. Being informed, being upskilled takes out that sort of feeling of intimidation. The main thing is that you go in there confidently with your information, and then you'll get a good, confident, strong, clear, reasonable answer, and you can know from then that the plan for your mother will be effective for all concerned. So thank you for your likes, your subscriptions, your interest. Please subscribe. I'm so happy about all those subscriptions. Genuinely, I can tell you. And that's it for today. Thank you.